With the average life expectancy creeping into the 80s, and with our senior population remaining more and more active into their aging years, it's now more important than ever to have reliable, successful joint replacement options. Tallahassee Memorial recognizes this need, and with the help of the iTotal Knee and the Inbone Ankle, they'll have you back on the golf course before you know it. Here are Dr. Thornberry and Dr. Geyer to tell you more.
We're seeing a great increase in joint problems in our senior population due to excessive obesity, plus just the general extra activity of our seniors. People are ready for joint replacements when they can no longer perform their normal activities of daily living without substantial amount of pain, and their quality of life has been lost. The iTotal Knee is a custom-made total knee designed for the individual patient. It is not a male-specific or female-specific or a custom cutting block. It is an actual knee replacement made custom for each individual patient. We're going to get a much more natural feel to the knee. I would consider this a high-demand knee for someone who wants to do more with their knee replacement than a standard total knee replacement patient. We're very honored that we're one of only 15 centers that was initially selected to introduce this new technology, and one of only 2 here in North Florida. We have been doing this since late 2011, and our results have been very encouraging, as well as the results of the other pioneering centers in the country.
For many years, people with hip and knee arthritis have had the option of total knee and hip replacements for treatment. That option was not available in the United States for ankle arthritis until more recently, when the technology has finally caught up with that of hip and knee replacements. Today, an ankle replacement is an option for people suffering from debilitating pain due to ankle arthritis. The primary benefit of an ankle replacement over treatments in the past is that it allows the maintenance of normal motion of the ankle. This allows people to walk more normally and maintain an active lifestyle a little more easily than they did in the past with an ankle fusion or a brace. Basically, the worn out portion of the tibia or upper ankle joint and the worn out portion of the talus or lower portion of the ankle joint are replaced with 2 metal pieces. These 2 metal pieces then have a piece of plastic that's placed between them, and that slides, allowing the ankle to maintain its normal motion. In orthopedics, we are realizing that one size does not specifically fit every patient, and therefore, just like in knee and hip replacements, ankle replacements are designed to fit multiple patients.
My knees were killing me. I could barely walk on some days. Some days I was fine. Some days I would be in the middle of walking and all of a sudden something would give and I could not straighten my left leg. I had bilateral total knee operations about 2 weeks ago. But since then, every day's been getting better and better. And the one thing I do notice is I don't have the referred pain to my hips any longer as a result of walking funny with my knees. So I'm delighted to have had this surgery, and I'm glad I did them both at once. The physical therapy I am currently going through is just amazing. It's in different components. They take different steps along the way, but when you put it all together, it means I can walk, and I'm walking. It's 2 weeks after surgery. I'm walking. I am looking forward to getting back to being my normal self and getting exercise, walking, not having to worry about my legs giving out from underneath me, being able to get in shape, lose weight, get toned, get conditioned, have my cardiovascular exercise so I don't have to worry about relying on a lot of medications as I get older.
Dr. Hutchinson, we've just learned quite a bit about recent advancements as far as joint replacement goes, but successful orthopedic care involves much more than just the equipment. So how is patient knowledge helping you see success in what you do on a day-to-day basis?
Well, patient knowledge is really important for orthopedic care. It's very important that the patients have realistic expectations and real knowledge about their condition, their treatment, and their rehab afterwards to be involved in their care and have good outcomes.
Now, TMH has just embraced a program called Own the Bone. What is that?
Well, Own the Bone is a program that's been started by the American Orthopedic Association to help treat fragility fractures. There are over 2 million fragility fractures a year in this population, which is more than heart attacks, strokes, and breast cancer combined. And we're just seeing the beginning of this epidemic of fragility fractures or fractures related to osteoporosis. This is a program that involves both patient education, patient identification, and communication with other physicians in the region.
So you're giving these patients then tools to hopefully prevent such a fracture?
Yes, we're identifying when they have their first fracture because once you have your first fragility fracture, you're 50% more likely to have another one related to the osteoporosis. So we're identifying these patients at their first fracture to hopefully prevent further fractures.
And how do you judge the success of a program like this?
With numbers. We're going to be monitoring these patients, collecting data on them, and hopefully we will be able to prove here at our hospital that it's as successful at preventing secondary fractures as it has been in other hospitals around the country.
All right, great. Well, thank you so much for talking with me. It's a really interesting program that you're working with. And when my knees start to say no to tennis, I'm going to come and see you.
All right, thank you.